Good morning, everyone, and welcome to the latest Detroit Regional Chamber Town Hall. We are so glad to have you with us and that you would take your valuable time to spend again with the Detroit Regional Chamber. Today, we are going to talk about perhaps the most important issue facing the globe today, and that is where are we and what is Michigan's role in developing a potential vaccine to combat the COVID-19 novel coronavirus. And joining us today, we are very pleased to have one of the great experts in the field, Henry Ford Health System medical doctor, Allison Weinmann, whose specialty is in infectious diseases. So, Dr. Weinmann, welcome to the Detroit Regional Chamber Town Hall.
Thank you. Thank you for inviting me. It's a pleasure to be here.
Well, great. Well, we've seen you on TV, and we're just honored to have you on our screens today, and we look forward to a discussion. As always, we're going to do our very best to take questions from our audience. And audience, if you look on the right-hand side of your screen, you will see a little drop-down menu. You might need your bionic eye. It's in small print, but it's a question box. So feel free to open up that box and type in a question. My friend and colleague, Tammy Carnwright, the Chief Operating Officer of the Chamber, will be monitoring our chat box, and hopefully we'll get a couple questions in from the audience. But we have a lot to cover with Dr. Weinmann today, so I'm going to jump right in. And first of all, Doctor, tell us how you and your colleagues at Henry Ford are doing. The battle that you all fought in the spring was an unprecedented challenge, never really seen before, to the health system and to your colleagues. But how are things today at Henry Ford?
Wow, thanks you. That's a big question. We are doing okay. We obviously had a huge, really unprecedented challenge that we, truthfully, I think nobody in the nation was expecting it to be quite as bad as it was. It was definitely the most challenging thing that I've encountered during my time as an infectious diseases specialist. You know, it was, first of all, there was a lot of disinformation. We just didn't know much about the virus to begin with. So we did not know what kind of clinical illness to look for. We were kind of surprised at the beginning that this illness can present with multi-systems involved. We were looking more for a respiratory illness. So our hospitals were all pretty full of COVID patients. And of course, there was the fear of, you know, most epidemics don't impact healthcare workers. We know how to protect ourselves. It's really clear how you get infected. This was not so clear at the beginning. And there was so much community transmission. People were also getting, our workforce was getting infected in the community, at work, because we were all in the community as well. So there was a lot of apprehension amongst healthcare workers. And I think that, you know, Henry Ford Health System has amazing leadership, and I think it really came to the forefront that we, you know, formed a very functional incident command system and really addressed issues as they arose, and were able to really have people come together as a team. We're always a team here, but to come together in that particular way was really extraordinary. I think things now, people have a level of comfort with dealing with COVID patients in a way that we didn't have in March. Things are not as frenetic as they were, and we're certainly seeing a shift in the hospital. We're now largely non-COVID patients, but every patient, you know, we teach our fellows, we teach our residents, show me why this is not COVID, because the consequences of having somebody not properly isolated is concerning. And we also understand a lot more about testing. We understand a lot more about treatment. So we also understand the clinical course a little bit better and have positively impacted that in a good way for patients. But there's no question that this illness devastated our healthcare system and our community.
Well, just, you know, on behalf of all of us, Doctor, just the incredible work that the Henry Ford team and frankly the medical professionals all across the region put in was just a huge sacrifice and a huge benefit. I'm coming from a medical family myself. I'm still really gratified to see all of the thank you to our healthcare heroes yard signs in my neighborhood. So thanks again on behalf of all of us.
Oh, thank you. That means a lot.
Absolutely. So let's start with some big pictures questions when it comes to kind of the fight against COVID. The world is obviously waiting for a vaccine, but the environment in which you health professionals are operating is obviously unusually challenging. First global pandemic in a while, certainly the one of this scale in a century. We have political pressure that we've never really seen a political dynamic when it comes to vaccine development. The growth of the anti-vaccine movement that we've seen kind of born out of disinformation on the web, all while we've got 900,000 people globally who have died, 6,500 people right here in Michigan who have died. When the vaccine is ready to go, doctor, how do you think the health professional community is going to overcome some of these challenges that society has presented itself to ensure that people actually get the vaccine?
Yeah, I think those are all really great questions. I think that, the vaccine development is obviously, there are many vaccine candidates, all that work in slightly different ways, which are all under a lot of testing. We are participating right now in the Moderna vaccine in phase 3 clinical trials. It's really not clear, there's several other vaccine candidates at the same level, so really testing in large numbers of patients to look for safety and efficacy. We don't know how quickly that data will accumulate, because a lot of the data depends a little bit on not only antibody levels, but a sufficient number of people actually being exposed in their lives to COVID and seeing whether there is a protective effect. And in Michigan, as you know, luckily our prevalence has actually dropped in the community significantly to around 1 to 2% now, which is great news for our patients in our community, but actually conversely kind of impacts how quickly you can get results from a vaccine trial. So when and if there's a vaccine or multiple vaccines that are licensed and approved and are disseminated, it is likely that in the short term, there will not be a huge supply of vaccine. So the state, the CDC, the state, and all of us involved in our individual health systems are actually looking at ways of equitably distributing what vaccine is available and looking at different ways. There's some national guidance on this, and everybody is like forming committees and trying to figure out what would be an equitable way to address distribution of vaccine, given that there are many high-risk groups. As well as that, you're quite right, the anti-vax movement is not new, unfortunately, and we've combated it during the measles epidemic, every year with influenza in particular. There's a lot of misinformation around, and a lot of people have said, just frankly, I'm not going to be first in line to get that COVID vaccine. And I think it's made more complicated, as you refer to, that there is some distrust because of the politicization of the vaccine process. And I can understand that. So I think that, it's unclear right now what the voluntary uptake will be for that vaccine when it becomes available and when it becomes available. And I think people have to have confidence that, there will be good science that, as you know, I'm very pleased that the vaccine distributors have come forward for that statement, saying they're going to make sure that there's a safe and efficacious vaccine before moving forward. But I hope will reassure people, because I think there's a strong lack of public confidence in the process right now, which is a shame, because when we get a vaccine, hopefully it will be a very good one, even if it's one that needs to be repeated even annually. It's going to protect people from this really terrible pandemic that we've been experiencing.
Absolutely. Now, you mentioned that once the vaccine or vaccines are approved for general public use, it's going to be limited at first. What do you anticipate the timeline, the rollout timeline? So, we've got a set of vaccines that are available for public use. How many weeks or months do you anticipate it will take to start rolling out an approved vaccine to the public?
Yeah, I mean, that's really the million-dollar question, isn't it? I don't know. I think, there's a lot that's been in the media. I would anticipate by next year sometime we will, and that's what most experts are thinking, there will be adequate supplies of vaccine. There may not be quite enough for everybody, but it's anticipated. And I've seen different timelines for different vaccines. So these companies are ready to ramp up as soon as they know if the vaccine is safe and efficacious. The question is when that data is going to be in. And there's been a lot of talk about it being by November 1st. I don't think anybody in the scientific community really thinks that we're going to have good data by then. It may be by the end of the year, but I think also that may be a little over exuberant. It depends. There may be a great vaccine candidate that comes forward. We just don't know yet because we don't have the data and we haven't even finished enrolling in these phase 3 clinical trials. So I'm hopeful that if we get a vaccine candidate or multiple, more likely multiple vaccine candidates that seem to be efficacious, sometime next year, there would be widespread distribution of these vaccine candidates. And that's what we're hoping for. But I don't have any inside track to knowing that, but I'm hoping that's the timeline. I'm hoping next year will be the golden year and we can put 2020 behind us.
Yeah. Well, we were hoping you had a crystal ball that could give us an exact date, but we'll take your professional advice. So you've mentioned the Moderna trials that Henry Ford is participating in, the first health system in Michigan to participate in a phase 3 trial. You mentioned phase 3 trial, so let's focus on that a bit. So for non-medical persons like me, can you describe the process of how a vaccine is approved and comes to market, where phase 3 fits into the process? Like, is there a phase 4? Is there, and what happens in phase 3 and why is phase 3 so important?
Yeah, those are good questions. So, the phases really don't matter. It's really the concept. So the concept is a vaccine target is developed and it's manufactured, and then it's tested usually in animals, and then in a small number of healthy volunteers to see if it seems to be safe and it seems to be efficacious, and we're talking a small number. And then once those vaccines get to that phase 2, then they go into phase 3 trials where you're looking at larger number of people. So for example, Moderna is looking at testing, using the vaccine, I should say, it is testing, but it's also using the vaccine on 30,000 volunteers. Now, only half of those people are going to get vaccines. So what we're looking at is placebo, which is just, a shot with saline in it, versus the true vaccine. And the patients and the investigators were blinded. We don't know who's getting what. And there's 2 doses to this vaccine. And then they're studied over time with diary visits and check-in visits and antibody tests and so on, quite extensively for a period of time to make sure that they seem to be safe and effective. And obviously, the more people that you give a vaccine to, a small number of side effects will hopefully become evident that weren't evident earlier when you only tested a small number of people. So that's what you're looking at. You're looking for, number one, is it safe to give to people? Are there certain age groups or there's certain risk factors in people that make it more or less useful in certain age groups? For example, flu vaccine is usually less effective in people as they get older. And so the vaccine had to be modified for the older age groups. So they're also looking at, are there different age or risk factors for the individual that make it more or less effective? So there's lots of pieces that go into it. Is there an age group where there's a particularly high risk of a toxicity? And that's hopefully what you're going to see in a phase 3 trial. And then you're also going to see, all of these vaccines have been shown to produce antibody, but you're also looking at durability of antibody. And does that antibody translate? So the antibody is what you make in response to a stimulus like COVID-19. It's modified somewhat. And then is it going to recognize COVID when you're exposed to COVID naturally? Is it going to recognize it to the point that's going to protect you? And that's the goal of these vaccines. And then once phase 3 trials are completed, usually then the companies apply to the FDA to say, look, we've tested it, we think it's safe and effective, and now we'd like to apply either for expedited use or for use. And usually this whole process takes several years. So this has been really an amazing national collaboration to come up with so many vaccine candidates so quickly. It really is unprecedented. It's just that we're not quite there yet. And even though everybody wishes we were there yet, we're not. I think, does that answer your question?
Yeah, it does. And, I was just going to add, certainly the federal government has put significant amount of money on the table to support these US-based trials and vaccine development. So that's certainly good news. I want to move to you hit on that the Moderna trial has required 30,000 volunteers to be a part of that. I'm just curious. for the Henry Ford trial, you're part of the Moderna trial, how many volunteers did you have to recruit? And is that an easy process? Is that a really difficult process? And how do you go about recruiting volunteers for, hey, we have a vaccine that we're not quite sure works or not, want to give it a try?
Yeah, so I think sort of the same as any kind of clinical trial. You put the news out and you say, hey, we have this vaccine, and obviously a lot of healthcare workers and the general public ears to the ground, and there was publicity around these vaccine trials, and and nationally, Moderna has not had a huge amount of trouble recruiting. It recruited actually quite quickly. But don't forget that the recruits may be of a particular type of person that may be more likely to come forward. So it may not be that you end up with all the volunteers you want, for example, in people of color or people of a certain age group or people who have certain comorbidities. So it may be people that perceive themselves to be healthier or other things. So when you're asking for volunteers, I mean, there are criteria for entering the trial, obviously, but it may be top heavy with people that are young, healthy adults who generally do better with vaccines than other groups. And you're really interested in how these vaccines perform in all groups.
And I think that's a really important point, because obviously we have seen, certainly nationally, a disproportionate impact of COVID on communities of color. And so the vaccine trials take that into account?
They do, and all of them are looking at, trying to get high-risk groups. The one thing I will say about COVID is it's a very tricky illness. So we think we understand who are high-risk groups. Having said that, we've all been quite surprised that somebody who has, checks all the boxes for being very high risk does very well with COVID, and somebody who is perfectly healthy succumbs from COVID. So it's a very humbling disease. A lot of diseases we understand much better who's going to do well and who isn't, and we're continually being surprised by COVID that people who on paper should have done badly are doing quite well, and vice versa. So there is a little bit of that. We still can generally predict the risk factors, and CDC has risk factors out there, including people of color. But again, it is sort of a humbling disease. So you do want to check it against multiple populations to make sure it's effective for everybody.
Now, one of the competing vaccine candidates, AstraZeneca, their trial was put on hold this week because there was one individual who fell ill. We don't know if that individual fell ill due to the trial, but can you talk a little bit about how common is it for a trial to be suspended because someone gets ill? What does that exactly mean?
Yeah, so the question is it something the vaccine did to the person, or were they brewing something underneath before that? And so what happens is when trials are put on hold, and it's not rare that they're put on hold, and actually, as Dr. Fauci said on the news, it's a good thing. It shows that the scientific process is working, that AstraZeneca is taking it seriously to investigate. So what happens is now an intense investigation will go on around that individual and any other individual that has a severe side effect to try and figure out from the timeline whether something was going on with the patient beforehand or not, or whether the vaccines seem to produce the ill effect in the person. And sometimes it's not clear, but it certainly was enough to make AstraZeneca stop and say, we really need to do a deep dive before we put more people potentially at risk if it was the vaccine. And right now we just don't know the answer to that.
Yeah, I was comforted by Dr. Fauci's comments, because it does show that even with the global pressure, political or otherwise, the pharmaceutical companies are taking all the necessary precautions.
Right.
We're about to enter flu season. Talk to us, Dr. Weinmann, about why this year's flu season and the flu shot take on particular importance this year.
I'm very excited to talk to you about that. As you know, Henry Ford Health System has been one of the leaders against influenza. We went to a mandatory vaccine for all of our 33,000 employees about 10 years ago. So you can't work at Henry Ford unless you're immunized against flu. And the reason for that is because you can be infectious for a day or so before you get symptoms. So we don't want to infect any of our patients, and we're very proud of that as a patient safety initiative. And we were the first in Southeast Michigan, as you probably know, to institute this hard mandate. So we're always interested in influenza. This year is very important. So remember, influenza by itself can be a formidable disease. there is appreciable morbidity and mortality with flu every single year, up to about 49,000 deaths per year, which is actually a lot in the US, and many, many more hospitalizations. We have a couple advantages with flu that we don't have with COVID. Number one, it's a rather distinct clinical entity. We understand flu a lot better. We have a vaccine that's, even though it's not a perfect vaccine, if you can get enough people immunized, you can prevent community transmission. And we also have some fairly good treatment for influenza that is well established. So this year in particular, we're worried that, so every year we have lots of people in the hospital with flu. And again, we never know ahead of time how bad the flu season is going to be. It depends a little bit on what strains are circulating, how good a match it is with what vaccines are available, and what strains of vaccine are in each product for the upcoming year. And we never really know until, because influenza is very tricky about changing its genes up every year. And so we never quite know how many people are going to occupy beds. So that's one concern, because if you can imagine, if we're all a little bit worried about a COVID surge in the fall, and if that coincides with a flu surge, number one, we're very worried about people getting co-infection. So each of these diseases has appreciable morbidity and mortality. One can only imagine that having them together would not be a good thing for patients. So we're very worried about preventing that. As well as that, we don't want to have people who could have had flu prevented by vaccine, or at least severe flu, so they won't need to be hospitalized, taking up beds that we may need for COVID patients. And then the other group that we're very concerned about is people who already had COVID. A lot of these people have, we're not sure yet, but some of them have some chronic lung issues. And influenza is primarily a respiratory virus. And so we are concerned that somebody who previously had COVID now falls into a category of a high risk for severe influenza, and may actually have much worse of an outcome from flu than if they hadn't had COVID. So we want to make sure all of those people are protected. So for all those reasons, we really want to emphasize influenza vaccine. Now, it's not a perfect vaccine, there's no question about it, it's imperfect, which means that we really need to get everybody immunized. And for many years, CDC had, and we've been promoting everybody in America over the age of 6 months, there's a vaccine for you. So there are different variants of vaccine. We have vaccine that's more effective in elderly people, older people over 65. They're no longer elderly at all. And there's different age groups and different vaccines that are available. The more people that get immunized, the less community transmission there is. So obviously, if you can get the bulk of our citizens immunized, that's a public health measure. Now, normally globally, or in the United States nationally, about 40 to 50% of the population takes up flu administration. That's pretty pitiful, really. The goal is to get 70, 80, 90% of the population immunized. So we partnered with a lot of people in the community and pushing really hard this year, especially to try and bring vaccine out to the people, out to the community, because we're seeing fewer patients, even in our clinics. A lot of people are still doing video visits. We're having less face time with patients in our own sites, even though now we are bringing back all of our clinics and our surgeries and all the rest of it. We don't want to miss an opportunity because we saw somebody in a video visit. So we're emphasizing, we don't care whether you get vaccine at Henry Ford Health System, whether you get it at your CVS or Rite Aid, just get it. There is a national push for this, there's a state push for it, and we are certainly pushing very, very hard. This vaccine, as I said, is not a highly effective vaccine, so it's vitally important that we get everybody vaccinated. And again, I think this is just a community service. There are a lot of myths out there about flu vaccine, primarily that you can get flu from the flu vaccine, which is completely false. The vaccine shot is inactivated, so it's biologically impossible to get flu from the flu vaccine. It does take a couple of weeks from the time you get immunized, so we're emphasizing that everybody should try to get immunized early. We also never know exactly when we're going to get flu in Michigan, when it's going to spike. We sometimes see a big spike in October, and then we see another one in January, February. Sometimes we just kind of see steady activity for many, many months. Sometimes the flu season can go even through June. So we never know. So since you get your shot today, it'll take you a couple of weeks to reach maximum immunity. So you're vulnerable for those 2 weeks. That's why we're saying to everybody, please try and get it this month. So in case we have an October surge, you'll be ready, and you should be protected for the rest of the year, especially if everybody gets immunized.
And this obviously applies to all of us who are working from home for at least the next few more months.
It applies to everybody. And, I just think it's sort of a community service. I think if you live and work in the community, whether you're home, you're going to venture outside sometime. It's really important that you protect everybody else, just like we're urging everybody to continue wearing a mask. COVID's out there. It has not disappeared. Just because our prevalence is down, people really should not feel falsely reassured. It is out there, and we have a huge number of vulnerable citizens. So masking is going to be very important, continuing social distancing, which is obviously going to get much harder as it gets dark earlier. We can't do things outside anymore. And I worry about what's going to happen to those of us in Michigan who, it gets dark really early here, it's cold, people are not going to be able to socialize so much. And people are so sick of this, people are really sick to death of it. And I think people are kind of getting a little lax about these maneuvers, and hand hygiene is always important. So, I'm hopeful that with universal masking, and if people are able to follow that and actually continue doing that, it may turn out that we have less respiratory viruses like influenza in the community, but we can't count on that. So all we can do is do the single best intervention we have to prevent influenza is still vaccine.
Dr. Weinmann, we haven't got to audience questions yet, and I'd like to, but only with your permission. Do you mind if we go a few minutes over?
No, that's absolutely fine. I'm good. Thank you for asking.
Okay, great. Let me turn. Yeah, great, perfect. We appreciate you being generous with your time. Tammy, do you want to run through a few questions from our audience? Tammy, are you there, or are you on mute?
Here I am. I had to take myself off mute. Yes. So first question, Dr. Weinmann, if Moderna or Pfizer or any other vaccine is released in late October, the current Moderna COVID study at Henry Ford be terminated early in that case?
Yes, I think right now, I don't think really anybody is thinking that it's going to be released that early. I think none of these trials are going to be concluded or analyzed by then. So I think that timeline is really just not on the table. If a vaccine became available early, people can opt out of the trial, obviously, and get vaccine. But I think that timeline, it's just really hard to see that happening.
Okay, thank you. Can you comment on the recent information released about vitamin D and its role in protecting against COVID?
Yeah, so there's been lots of things that have come out. People are just desperate to find something that's protective. There's nothing that's been scientifically proven except for masking, social distancing, and hand hygiene. Those are the three measures. So I would encourage people on top of that to try and get exercise, because that's going to protect you. Try and keep your weight down, because we know being overweight is a risk factor for severe COVID, and that's something that's somewhat within our control, although a lot of people have gained weight being at home and boredom eating or whatever. And try to get some rest. All those things are really important in keeping your immune system well, and trying to eat fairly healthily. And I think really, apart from that, the emphasis should really be on what we know works. And that's the good news. The good news is we know pretty much how to prevent transmission. So even though there's debate about whether, how long particles remain in the air and all the rest of it, and yes, we worry about surfaces, what we really worry about is lots of people getting together and sharing their respiratory droplets. That's what the concern is. So,
Sure.
And inside is always worse than outside. Lots of people together. Unmasking is always worse than masking. So we sort of know how to protect the population. We've seen that in multiple studies in multiple states and countries in the world. You need to wear your mask whenever you're out in public, and it needs to be properly worn over your nose. I think the other thing is we have to, as citizens of Michigan, be bold when you see somebody not wearing a mask properly, to say, hey, would you mind popping your mask up, to keep me safe as well as you. I think that's really important, to be able to make it the norm to be wearing a mask normally. And then social distancing, this just has to continue. So all these things like vitamin E, that's great if you think they work. There's no scientific data. What we know works is what's unpleasant, which is masking, social distancing, and hand hygiene.
Yeah, that's such a good point. And it's funny, I guess I have never thought about actually if you see someone who is not masked up, please asking them to do that. So I think that's good advice for all of us. This next question, I'm sorry, please.
I was just, it's a tricky issue, isn't it, with correcting people with masks, because there have been some episodes of violence associated with that. So, like I say, I think we should all make it the norm that we do that. I think each individual circumstance, you just need to be a little bit careful because you don't know who you're talking to. Some people have made this a political issue when it's really not. It's a public health issue. But I would just caution people to be a little bit, even though I'm saying that it would be nice if we could remind people. I find most people, when you correct them, someone comes into your house, for example, to do repair work, is going to be very receptive, I think, to doing that. Somebody out in the community, maybe if I walked into a grocery store and the person, around me and was not wearing their mask properly, I'm not sure, how much to push that with someone I don't know. I might choose to leave the store or walk around them or not be near that person. But hopefully they'll get the hang. If everybody else is wearing their mask properly, I think that is a bit of a social pressure. So it's nice if we can step up and say something. And it's nice that the governor has given us that power, but there's still people that will take this the wrong way and make it a political issue. So I do want people to be safe while they're protecting themselves as well in all ways.
Good counsel. This next question, I'm going to guess, is one you've heard and many may be wondering about. Is it safe to vaccinate someone who is positive for COVID with the flu vaccine, or do they need to be free of COVID?
Yeah, so that is a good question. So generally, we don't give vaccine if somebody is moderately to severely ill. And it's not usually a safety issue. We don't think you're going to do badly with the vaccine, but we think it may be an efficacy issue. So it probably won't be as effective. So generally what we do, if somebody's sick enough to be hospitalized with COVID, I would probably defer their vaccine, for a week or two until they're improved. They don't have to be totally back to normal, but certainly if somebody's still having fever or in the acute phase of their illness, I don't think it's a bad thing to wait a little while. But again, you want to make sure that you don't miss a vaccine opportunity. So you want to make sure that person's scheduled to get their vaccine, that they check in with you and you clear them to get their vaccine. So we don't recommend people who are acutely sick to get the vaccine. Again, say the vaccine gave you a little fever, it might be confusing if you're also sick with something else. So again, we don't think it's a safety issue, but we do think you're probably going to get more bang for your buck and get a better response to the flu vaccine once you're a bit better than being sick in the hospital.
Actually, let me jump in on that question because I think it's an interesting one. I'm sorry, Tammy. I was just going to ask.
No, okay.
Maybe if the question is directed towards those people who might have a positive COVID test but are asymptomatic. In other words, they're part of that big group of people that feel fine but have a positive COVID diagnosis.
Right. So that's actually a really good question. I was kind of hoping we didn't talk about testing, but I'm very happy to engage in it now. The testing we have for COVID is tricky. It's tricky to interpret. So we do know a lot of people who had COVID will have a positive nasal pharyngeal swab for some weeks afterwards. And we think that not all of these people represent infectious people. We think sometimes that's just fragments of virus that are non-viable, that are still hanging about the nasopharynx. And similarly, the people that we're interested in who are asymptomatic, and I would still encourage people to get tested, even though there have been some national guidance saying that we don't want to test people. We're interested in those asymptomatic people because at least for a couple of days before they develop symptoms, they can be infectious. And we do know that some groups of people can be asymptomatic altogether and can be infectious for some period of time. So if you were asymptomatic and you happen to have a COVID test that was positive, I would say you can go ahead and have your influenza vaccine. So it's usually moderate to severe illness that precludes vaccine, but if you're otherwise well, then I would say fine to go ahead and get vaccine. Again, it's kind of everything in medicine is what's the risk, what's the benefit? What's the risk, what's the benefit? So somebody who is asymptomatic from COVID, and they're not having any current problems, I would say, listen, now I'm worried about you getting influenza, and so I don't want you to get sick with influenza. So I think in your case, the benefit outweighs the risk. But I think those people should have a conversation with their healthcare provider. But in general, it's just people who have moderate to severe illness. Certainly if you're sick enough to be in the hospital with any kind of infectious process, especially a respiratory virus or any other virus that like COVID, we would recommend that it just be deferred, but not indefinitely. You want to get vaccine into people as quickly as you can once they're improved.
Well, perfect. Well, listen, Dr. Weinmann, thank you for extending your time with us. Tammy, thank you for cultivating the questions from our audience. Dr. Weinmann, I just want to give you the opportunity to make any summary comments as we wrap up today.
Thank you. So I would just reiterate the importance of that COVID is not gone. And I think there are a lot of people that are feeling a bit complacent and very worn out from this. And I totally empathize with that. But now is not the time to let down your guard. So masking is just part of, part of life now, and it needs to be continued for the foreseeable future. Social distancing, painful as that is for many of us, you have to continue to socially distance. Please don't get together and have parties inside unmasked. Those are the people that we see coming in with COVID, or people have been exposed to those people. And then the other very important messaging is there's plenty of flu vaccine. It's available now. Please get out and get it as soon as you possibly can this month to protect yourselves and your loved ones and our community.
Great. Dr. Weinmann, again, thank you for being generous with your time. Thank you for lending your expertise, not just to our audience, but to your day job at Henry Ford Health System. We thank you and we thank your colleagues for all you're doing for our community.
Thank you. I'll pass that on, and I appreciate the opportunity very much to meet all of you. Thank you.
Great. Dr. Weinmann, thank you. And to all of our guests who have joined us, thank you so much. And we look forward to hosting you at our next Detroit Regional Chamber Town Hall. Have a great day, everyone. Thanks for joining us.
Bye.
Bye now.